Hello everyone, my name is Anthony Macarhon, first year GTCC student and aspiring surgical technician. I know, right? I don't know why I ended up trying to get into the program anyway, but that's beside the point. First thing, what can you say about cancer? Scary, right? Other than the zodiac sign, I mean the disease. But let me give you a little hint about what I'm going to present today. I'm going to give you bits of information about on a safer way that has been resonating uh, on the Asian region about treatment about cancer. But first thing we have to do is discuss about cancer. What is cancer? Cancer cells are cells that divide relentlessly, forming a tumor, flooding the blood with abnormal cells. This picture is a picture of a cancer cell dividing rapidly, up, and that could be bad. At some time, it also release some hormones and well, it's just bad news. Now I'll give you two facts. Fact: 50% of cancer patients treated by chemotherapy die within 30 days. This is according to the Public Health England and Cancer Research UK. Second fact: in 2015, there were 1,658,370 people that was newly diagnosed with cancer, and at the same year, there were 589,430 deaths, according to the American Cancer Society. I'm sorry I just pressed that. Anyway, recognize this person? Yep, Patrick Swayze. That's before chemo, that's after chemo. Scary. I mean, he's dead now, but man, a lot of people lost their life. They wasn't, it wasn't their time yet, but chemotherapy kind of made it faster. Which led me to make a small survey, an unofficial survey in school, which I asked the question, if somebody has cancer, what would be the primary treatment that they would undertake? Unsurprisingly, 85% of them said chemotherapy. 15% say herbal therapy or stem cell therapy. But that being the case, 85% is a big chunk of the population, and it's sad. But let me tell you something about this breakthrough technology that they've been doing around the Asian region that has been very popular. And that is cryosurgery, a safer way, in my opinion. And a lot of people said that too. I mean, a lot of people is resorting to that kind of treatment. That's a safer way to fight cancer. What is cryosurgery? Cryosurgery, or otherwise known as cryotherapy, is a procedure that uses extreme cold, and then it is injected by means of liquid nitrogen or argon gas to the abnormal tissue, such as in the picture. And that is a cryoprobe, which is the instrument that they use that would be injected directly to the affected area. And this is how they, instead of making a big incision, this is how they would monitor the freezing. They use MRI and ultrasound to monitor the freezing inside the cell, therefore minimizing the damage around the area. In some cases, they use more than one probe, and And this is a diagram or an illustration of a prostate cancer cryosurgery procedure. And whenever the frozen cells is being frozen inside, it just breaks down naturally, or it will melt inside the body, and the body will absorb it as a waste, kind of like what we call in biology a phagocytosis. Now, for external procedures, a liquid nitrogen is applied directly to the affected area, and then it develops to a scab just like a normal wound, and eventually, of course, it will heal, which is really, uh, you wouldn't even think if it was a cancer, it would have a lot of treatment. But anyway, this is a minor superficial treatment that they would do. That's a good news, though. All right. Now, types of cancer that can be treated by cryosurgery. These are known to have been, successfully treated by cryosurgery. Prostate cancer. Yeah, I showed a picture a while ago. Liver tumors. Oh, God, that's whenever you're doing liver procedures, it's crazy. It affects a lot of your digestive system and everything around it. Retinoblastoma, something to do with the eyes. Early stage of skin cancer. Early stage of cervical cancer. And last but not the least, breast, colon, and kidney, which are three of the most common cancers that I've seen around. And although in the United States it's still under research, but in the Asia it's been already a popular procedure for them. Now, which led me to ask, what are the complications and side effects of such procedures? All right, compared to chemotherapy, it's not really as much. I would say the side effects gonna be less severe than the other ones, like surgery and radiation therapy. I think cryosurgery is less than what the particular as far as cancer treatment is. Next, effects of the procedure depends on the area, the affected area, and scarring, swelling, nerve damage, loss of sensation, loss of hair on the affected area. That's normal, but it's less severe than other therapies like chemo and radiation. Although the side effects are less, more studies are needed so that we can determine the long-term effects of the said treatment, but which is really good. That holds a lot of potential. Of course, it has its advantages and disadvantage. Let's see what their advantage and disadvantage are. First, the advantage: small incision. Because of the cryoprobe getting in there, it don't need much, but just a little incision, where just enough for the cryoprobe to get in and to be inserted into the abnormal cell or the tumor or the, the carcinoma. Less invasive than that of the regular surgery, of course. Now, less bleeding. It comes less bleeding, less pain, and lowering the chances of complications. And Shorter healing time. Yeah, of course. You have a small incision, you have shorter healing time. It makes it better for old people. Their cells cannot regenerate just like young people does. It takes time for their cells to regenerate and recuperate. Next, procedure focuses on a certain area. Remember the MRI I showed you? Yeah, that's how they control the spread of the freezing of the liquid nitrogen. So kind of like having frostbites. The frostbites around, that's the only part that's going to be affected. The rest, they won't even be, touched. But at least it's clean. What do you call that? Unlike radiation, a remnants of them isotopes is being left over there inside your body, and it takes some time to withdraw them. Next, can be repeated multiple times. Because of the nature of the procedure, it could be repeated multiple times. Now, as what I just said, the procedure is so minimal that it does the it does miraculously with people that has a different that is not fitted for surgery, or they have diabetes, or they have hypertension, or complications that prevents them from doing regular surgery or regular radiation therapy or chemotherapy. Now let's go to the disadvantages. It can miss microscopic cancer cells. I think chemo does that too. In my opinion, I've heard people having chemo, and then the whole area spreads the cancer, and before you know it, it's too late. Since less studies has been done and less research has been devoted